My name is Tracy Burwell. I am the VP of Operations for One Medical. We are a primary care provider. We have about 250 clinics across the United States where we provide primary care. And I run what we call centralized support operations. We take care of everything behind the scenes. So phones, all the back office work, medical records, all of those things are done in our centralized contact center. From a live support perspective, we have both phone and chat. And then back office, we do medical records in-house. Like we have to gather your medical records from someone, or we have to send your medical records if you're gonna have a procedure or something like that, right? And then we do what is also called advanced tasking. We brought in the CX1 platform. We use IEX for WFM, and then we use QM as well as performance management, after call feedback management, so after call surveys. We also use interaction analytics, which we just launched a few weeks ago, and now we are headed down the path of Enlighten, XO, and Copilot, Autopilot, Auto Summary. We want it all. I believe that having everything in one place is the way of the future. One Medical did not have a WFM system, and they had no metrics, they had no analytics, nothing. And so our thought process was, all right, we need to get a handle on our staffing first so that we can see the volume and the intervals in which it's coming in, right? So that's your foundational building block. And then we said, okay, now we feel like we've got a handle on that. We understand how to do shift bids. We're 24/7 now. We feel good about the structure and the queues. We started working on the IVR. So then with that IVR, how can we reduce contacts or move contacts out? So if we started listening to some of the calls, we went, wait a minute, why is everybody calling for our fax number? Let's just put it in the message up front. There's 20,000 contacts right out of the way, right? So we can start to focus on the harder things. Then we started using QM, so that we could dig deep and really make sure that not only where we use something called, our ethos is CI care, which means you are caring for everything that patient needs on the conversation or the phone call right then and there. And so now we could listen to those phone calls, piece them together, and also showcase what standard work they were using. So that was our next building block. Okay, let's get our arms around that. And what we figured out was our training wasn't good enough. Okay, let's go back and start with our training and rebuild our new hire training. And that all came from just, let's get our intervals staffed. Let's start listening to our phone calls. Okay, next, now we need to performance manage what they're doing. We were able to tie that all together, so now they have weekly one-on-one templates. They have their success metrics, so they know where they stand. Our building blocks have really been the WFM and the IEX suite. We need to know what people are doing every single minute of every single day so that we can make sure we're scheduled when our patients need us, specifically if you're 24/7.